welcome to my project for the Human Factors in AI course through Coursera and Duke University. This is my final project. The challenge that I've chosen for myself today is triaging patients in humanitarian efforts. So picture scenarios where you have not enough doctors, not enough nurses, not enough medical staff in a war zone or a disaster zone, and enabling people who have less medical training or even potentially no medical training to help out with the triage portion of the treatment so that the nurses and doctors can focus on treating patients and healing. Now, I have no medical training or expertise. I have no humanitarian experience or expertise. So there's a lot of assumptions I'm making, but that's something that we often do in UX. We make some assumptions in order to get a first idea out there. So that is what this is. Let's start with step one, which is task analysis. I've boiled this platform down to something very simple, which is to rate the severity of the patient's wounds by low, medium, high, and how quickly those need to be addressed. So it's a very simple need. That is the goal, to just rate the wounds so that the proper medical staff can then do the next level of triage and make sure that patients are treated in the most critical order. Let's look at the UX of the platform. So I've done a quick mock-up here, which shows that the triager would put in the symptoms that the patient is experiencing, and then the platform would start to suggest percentages of severity of those wounds. Now, the platform would need to not suggest any percentages until it has enough information to make that suggestion. Also, these are just suggestions. So at any point, the user can uh, click on this color and print out that sticker that they can then attach to the patient to indicate the level of severity that they're going through. So it's very important to have a human in the loop, a human making interpretations here. This platform is there in order to help with that interpretation, especially when somebody doesn't have as much medical training, but it's not meant to supersede the human in the loop, the human decision. This platform would need to be more holistic than just an app. It would need to have probably extra battery power. It would need to have a printer attached to it so that I can print the sticker and then also print some of the diagnosis that was done, the time that the diagnosis was done, in order to provide a bit more information to the medical staff. The platform, as it's doing the analysis, it could also ask questions. So rather than just the triager inputting information, it could ask questions. It could present options. So we see here, it's asking a question about, was the bleeding able to be stopped? And it provides some options rather than just having to type in, right? So remember that this is a high stress environment. We need to keep things as simple as possible, especially with potentially untrained folks. To really just make this something that is easy to get started with no training at all. The platform would also need to indicate why the level of severity was chosen. So in this case, it says the gunshot wound, not in as risky of a spot. The client is bleeding slowly, but as long as they're treated within a reasonable time frame, they're likely to survive. So hopefully by getting this information really quickly and providing a really simple actionable step, that will help staff who are, who don't have as much medical training, if any, to do this role, freeing up medical staff to treat patients and provide healing. Okay, let's dig into number 3, privacy considerations. This is a very interesting application in that we're not collecting any names, any information about the individual except what wounds they're experiencing. So a lot of the privacy problems that come along with medical apps are really not there because we aren't collecting too much individual information beyond their wounds. This data could be really useful though, and we definitely want to collect it for opportunities to improve this application. Collecting this could help with addressing other humanitarian efforts in the future, but it should be encrypted. It should only be shared with the necessary people. So I would picture this being shared with the developers and then potentially an organization like the WHO who could organize the information and release it in a responsible way. But again, it should all be encrypted to begin with and massaged to remove any potential identifiers before being saved and potentially distributed. I do also think that interviews with triagers would be very helpful to improving this app, but overall, not as not as risky from a privacy concern as most machine learning apps. Okay. Okay, let's dig into number 3, privacy considerations. This is a very interesting application in that we're not collecting any names, any information about the individual except what wounds they're experiencing. So a lot of the privacy problems that come along with an app like this, with a medical app like this, are really not there because we aren't collecting too much individual information beyond their wounds. This data could be really useful though, and we definitely want to collect it for opportunities to improve this application. This data might not exist yet, and so collecting this could help with addressing other humanitarian efforts in the future, but it should be encrypted. It should only be shared with the necessary people. So I would picture this being shared with the developers and then potentially an organization like the WHO who could organize the information and release it in a responsible way. But again, it should all be encrypted to begin with and massaged to remove any potential identifiers before being saved and potentially distributed. I do also think that interviews with triagers would be very helpful to improving this app, but overall, not as not as risky from a privacy concern as most apps, as most machine learning apps typically are. Let's talk number 4, ethical considerations. So bias risks. The training data on this platform is a huge risk for bias. This platform cannot just be trained on hospital data from American hospitals. It would need to take into account being deployed at a moment's notice anywhere in the world and the different challenges that the different locales have, etc. So there's a huge risk from using the correct training data. And then also, how do you test an app like this? How do you deploy it in the field in an ethical testing manner? Taking somebody up that could be doing work and instead having them test a product like this in a disaster area, that feels like there's some ethical considerations to happen there. So there's definitely some problems to solve in that area. From a fairness and biases aspect, this platform could potentially reduce biases by supporting human decisions with data. We know that humans can make different decisions based on different days, based on different levels of energy, based on subliminal biases. So by presenting fair and unbiased data to help support those decisions, we can potentially help reduce the human biases. This does not mean that we remove the human from the equation. The human should be ultimately making these decisions and these calls. You have scenarios where a computer simply cannot address the scenario. So maybe you have a criminal with slightly a higher risk of and needing treatment sooner versus a mother of 4, and you have to think about the impact that decision has on the world, who you treat in that situation. Do you treat the person who's first in line, or do you treat the person who can ultimately make the world a better place? It's a very hard decision and not one that a computer could make. Accountability. All data input onto this platform, even though it's not tied to individuals, should be encrypted. These devices are not inherently connected to the internet or the cloud because they need to function in areas that might not have Wi-Fi, and you can't wait for the internet to update. You can't take any risk there. All of this information would need to happen on the device, and it would need to be encrypted in case it falls into the wrong hands. People are very clever with how they make deductions. Hackers are very clever with how they make deductions, so we don't want to leave any room for that. All information should be subject to developer review. The feedback loop can, of course, be recommendations can be made by an AI, but it needs to be a human making decisions or multiple humans making decisions before improving the application. There's simply too many risks, too many problems here, and every update needs to be made with intention. Information should not be disclosed without to anybody like a responsible party, like maybe the WHO, and then they could interpret how to release this data in a way that could potentially benefit the world and potentially benefit future disaster zones. Last of all, transparency. One of the ways that we bring transparency is by showing the triager why these assessments are being made, why these percentages are being recommended, and by presenting these percentages and then passing on that transparency to the treatment staff. This is not perfect. There are likely levels of percentage within each of these percentages, and but we have to make this trade-off of user experience and introducing somebody to a platform in a very high stress environment with potentially little or no training. We have to make the trade-off of what is something that they can comprehend quickly and get to using quickly versus, that versus accuracy. So this is the place that I would think to start. That is my presentation. Thanks for watching.